Yes. Yes, I could see you. So, as I was giving the introduction of Dr. Rachna, she is also working as an associate professor, and also she has written various articles and blogs related to homeopathy. She has her own YouTube channel called as Healthy Way, and she has been posting all our the series of videos of IWHP on her Healthy Way YouTube channel. So I welcome Dr. Rachna for the session. I am sure she'll be able to give us very useful tips and inputs as to how we could do something to manage this crisis situation. Yes, Dr. Rachna, please continue.
Yes, so thank you, Alka ma'am. And without wasting any time, let me share my screen and we will continue with the PPT. So, emotional and mental impact of war and how homeopathy can be helpful. So, we all know that the war has begun between India and Pakistan, and these are very challenging times for all of us. So, we are here to discuss about the emotional and psychological or mental impact of war upon the civilians or also might upon the soldiers as well. So basically, the war impacts upon all the three realms of human body, that is the physical, emotional, and mental. And homeopathy has the power to deal with all the three physical, mental, as well as emotional impacts of the war upon the human body. But I am here to deal with just the emotional and the mental impacts today in my PPT. But if we get back to the history of homeopathy, so we know that in the year 1813, there was some war between the European countries, and because of the war, there was contamination of water because the dead bodies were scattered and there was no proper, the facilities that time during that time. So there was contamination of water because of that, and due to which the typhus broke out. So there was an epidemic of typhus that time in 1813, and Hahnemann has described Bryonia and Rustox as the genus epidemicus of typhus, and all the cases that were treated by him during that epidemic, all were treated at that time when typhus was considered incurable, and homeopathy, the success rate was 100%. 100%, and Dr. Hahnemann treated about 183 typhus patients as per the records. So homeopathy has a very golden history regarding the physical impact of the war, also dealing with that. But today we have crossed centuries now, and if today we are going to be talking about the physical impact of the wars, then we will not be talking about the contamination of water, etc., because we have dealt with all those and we know how to deal with the contamination of water, etc. Today is the era of the bio war or the nuclear war now. So the radiations and different types of diseases or these kinds of things will be prevalent if we talk about the physical. But today here I am going to just deal with the emotional and mental impact of war and how homeopathy can help us to restore our emotional and mental health back. So first we'll talk about the emotional disturbances like the fear and anxiety, the grief, the hopelessness and despair, anger and resentment, hatred, and homesickness. So these are some top or frequently seen emotional disturbances during the wartime. So fear and anxiety is the most prominent thing that you are going to encounter during these times. People will have a constant fear of death or bombings or harm to their loved ones, especially the ones who are living near the border, etc. They will be having these because of the constant bombardings near them. They will hear all these things and they will go into panic attacks because of that constant noises or worrying about the loved ones who are in the army. So the fear and anxiety will be prevalent, and even if they are not living there or any of their loved one is serving in the army, still people can go through all this fear and anxiety by just watching, constantly sitting in front of the news and watching all the news that is regarding the war and etc. So that will impact their emotional health a lot as well. Then there can be extreme grief because of the loss of a family member or a friend. If they hear a news that so and so has died and was serving in the army, so they will be very very depressed, and they will say, "Arey, main to usko janti thi." So such kind of grief they can go through. Then there is hopelessness and despair, that there is nothing in the future. एकदम बेकार ज़िंदगी, अभी क्या ज़िंदगी में रखा हुआ, एकदम मीनिंगलेस हो चुकी है लाइफ. सो दैट काइंड ऑफ होपलेसनेस दे विल गेट. अभी क्या करो लाइफ में, बस यही लड़ाई लड़ाई लड़ाई, यही सारा कुछ चल रहा है. And the family members are coming, and then they are again going for years and months together, and then they are coming for 2 days, and then they are again going. So such kind of hopelessness can also prevail. Then in some people we can see a lot of anger and resentment towards governments, or towards the neighboring country, or towards a community, and etc etc, and they will be very angry, and a little, even the trifles can trigger them with so much rage and fury. So again, hatred also, sometimes this hate can be intensified during this war time. The hatred will, all the negative emotions will come up very very strongly in very intensified form during these times. So, and again, in some people there can be homesickness. They will feel extremely nostalgic and lonely. They don't want to talk to anyone else. They just want to go home. There will be extreme longing to go to home. So these are kinds of emotional disturbances that you can see during this time. And sometimes even when people are staying at home, they can feel homesick. So it is a feeling. It is not that you are present at home or you're not present at home. It is that homely feeling that you can still have while living at home also. Then we talk about the mental health issues that are prominently seen during these times of the war. So it's insomnia due to trauma or fear or disrupted routines, or some kind of excessive excitement, or some good news or bad news, or tension, etc. So insomnia can be very very prominent. Then again, eating disorders. We can see anorexia nervosa. People don't want to eat only. Especially you can see anorexia nervosa in young women. It is seen where the husband is gone into the army and is in the war. Then the lady will not eat anything because she's saying that she's not feeling to eat anything. So such kind of eating disorders also you can see during these times of the war. Then anxiety disorders, we have already talked about, that the frank panic attacks and phobias which are actually mentally sick. So mental issues are deep rooted issues and they are frank diseases, right? You can deal with some emotional disorders by counseling, etc., but real mental issues you cannot deal with counseling only. You have to give proper medication. So these are some disorders where they require medications. They will not go with counseling, etc. Then again, there is depression, very bad type of depression, which can also lead to suicidal thoughts or survivor's guilt. Like, मुझे क्यों छोड़ दिया, मुझे भी मार देते, उसको मार दिया, हस्बैंड को मार दिया, तो मुझे क्यों जिंदा छोड़ दिया. So this is a kind of survival guilt. The survivor, the person who has survived, is living in the guilt that why is he or she alive. अभी बचा क्या, मीनिंगलेस एकदम लाइफ है, तो मुझे भी ख़त्म कर देते. एक ही फैमिली के इतने सारे लोगों को मार दिया, अब मैं अकेला क्या करूँगा. So this is a kind of survivor's guilt where it can lead to suicidal attempts in future also. So these are the symptoms of depression. Then there is post-traumatic stress disorder, PTSD. So they can have nightmares and emotional numbness. Now this depression and post-traumatic stress disorder, these are generally chronic things. They will not occur in a day or two or just in a few days after a war. They will occur when the same situation is going on for months and months, and then you will find that such kind of cases are coming because of the war. So anxiety and this fear and phobia you can see in the acute state during the war, but this depression and the post traumatic, these things need time to set inside the body. Then there are some adjustment disorders like struggling to re-enter normal life, because there are so many changes in the routine that now they don't know what is the normal life, what the normal life is. Then some people can indulge into the substance abuse, like different kinds of addictions they will go into to just calm themselves, to relax themselves, or to stay alert or whatever. So they can deal into some or the other addiction, which is also not good, and it will impact their physical health as well in the later life. Then there is this depersonalization. This is a real deep mental disorder where there is a sense of disconnectedness from oneself or reality. In homeopathy, there is a medicine known as Illumina. If you study the mind of Illumina, there is a symptom where the Illumina patient looks into the mirror and he or she wonders whether it's her or not. उसको समझ में नहीं आता ये शीशे में मैं ही हूँ कि कोई और है. तो ये डीप मेंटल डिसऑर्डर्स जब बहुत ज़्यादा डीप हो जाते हैं तब ये उसका एक दिस इज़ वन ऑफ द सिम्टम लाइक डिसोसिएटेड पर्सनालिटी डिसऑर्डर और schizophrenia etc. Then there can be a special impact on children. Children are the worst affected by any war because they are highly sensitive, and they are emotionally very delicate, and with all the violence and the killing and the noises and everything, this is a very big emotional trauma to them. So as a result they can have developmental delays or problems like bedwetting, thumb sucking, speech disorders. Then they can have grave changes in their behavior, the behavioral changes like increased aggression or complete withdrawal. They will have nightmares, they won't be able to sleep well, then they will have difficulty trusting others, or in the later life also they can have difficulty in forming bonds and relationships with people. They will not have very good relationships because they are very frightened to open up with anyone. So they will be very withdrawn and closed personality. So that kind of trauma can impact their personality in that way. Then there can be learning disorders like there will be difficulty in focusing and like ADHD etc., the attention deficit hyperactive disorder, or frequent absenteeism. They can be एकदम खोए खोए से रहने वाले, not being attentive enough. That thing also can be in their personality. Then again there can be bipolar disorder in the later life also, like the two opposite poles of life. One time they are super active and the other time they are totally withdrawn and not into the society, being totally asocial. So now how can homeopathy help? So we all know what homeopathy is and how helpful it is, and what are the advantages of homeopathy, that it is highly effective, it is so easy to administer, and especially in this kind of emotional and mental traumas, homeopathy has worked wonders and helped to change people's personality or help them overcome these disorders etc. So and like I said earlier in my presentation, that we have a golden history of dealing with such conditions effectively. During the wartime, there are so many conditions that homeopathy has already dealt with very effectively. So we can still deal with all these conditions effectively. So I have a case here to share of mine, which I will share. This is a case of simple goiter, but I'll tell you why I am sharing this case here now. So this is a lady of 46 years. So she came to me with a simple goiter in February 2023. This is almost 2 years back now. So she is an Indian and she was living in Russia with family. So she returned from Russia and she developed this palpable lump in the throat, and also she had panic attacks and nightmares. Now she never told me about the panic attacks and nightmares because she was just consulting me for the this goiter thing and the thyroid. So but when I took the whole case, I did the whole case taking, then only I came to know that she was also suffering with the panic attacks and nightmares etc. So, regarding her swelling, it was painless swelling and a slight discomfort felt during swallowing anything. So, on my advice, she did all the thyroid profile, but everything came out to be normal. And she had this history of high fever followed by cough for 15 days last month. So, February she came to me, and in January she had this fever and cough for about 15 days. So and she also complained of a plug like sensation in the throat. So since last few days she is also having this panic attacks at night, where she woke up suddenly at night feeling suffocated and slightly perspiring. So after which she feared of falling asleep again. तो उसको डर लगता था कि अभी मैं दोबारा नहीं, मुझे नहीं सोना है, मुझे नींद नहीं आएगी, मतलब नींद भी आती थी तो भी वो डर के नहीं सोती थी कि उसको फिर से सपना आएगा बहुत, उसको शी विल हैव अ नाइटमेयर, सो शी वोंट स्लीप अगेन. Then she had a very good appetite with extreme thirst and dry mouth. She had desire for cold drinks and complete aversion to sweets. So this was all his case. So I divided all the symptoms into physical generals and the mental generals. So physical generals, there was thirst with dry tongue, hunger, it was good, aversion to sweets, desire for cold drinks, and there was aggravation on waking on because of the nightmares, etc. So the mental generals, there was high anxiety and fear of war. After I asked her about all these things, then she said that yes, she had that fear of war because that Russia and Ukraine war had begun and she had to come back to India. She was living in Russia. So after which only she developed this swelling of throat. So I took the whole case, I repertorized the whole case, and usually I refer to the Murphy's repertory. So her medicine was coming out to be spongia, and I just wanted to note and confirm that whether spongia is present in the panic attacks or not. So in the Murphy's repertory, I saw that spongia was present in panic attacks. However, it was present in the 3rd grade. But if we look at a sub-rubric of these panic attacks, so there was a clear indication of spongia. You can see panic attacks, throat in with. There is a single remedy given in capital, that was spongia. So I gave her a single dose of spongia tosta, and also I gave her a single dose of thyroidinum also. And these were all the rubrics that I had taken, and to my surprise the lump got completely reduced to normal within a week. I told her that it will take about a month so that she does not get impatient कि कब ठीक होगा, नहीं तो every time they are calling me back कि अभी तक तो हुआ नहीं, अभी तक तो हुआ नहीं, etc. So I tell them it will take a month, you have to relax. But I didn't know that it will work so fast, that in just a week she sent me her another photographs and it was all completely gone. So you can clearly see in the picture, the above two are the before pictures that she had sent, and the below two are the after pictures also that she had sent me. And she also said that she never had an episode of panic attack again after the medicines. So that was also important thing there. Now the reason why I shared this case was not because of the goiter or the thyroid thing. It was because that this the fear of war, that anxiety had set in her, and because of which she developed this thyroid or the goiter thing. So it was the war circumstances that had driven this lady into all this physical symptoms. Now here I have listed some important rubrics from the Murphy's repertory that you can go through, which might help you in certain cases. So anxiety, I have written a few of the sub rubrics of anxiety. However, anxiety has a whole lot of pages involved. Then we come to the mind, blood cannot look at. There are certain people who cannot look at the blood. Then there is a rubric, mind crying cannot. Cry though sad. So there are remedies like Ignatia and Natramurina Materia Medica, where they have such a deep emotional trauma or shock that they cannot cry. So for example, there is a death of a loved one. उसका हस्बैंड की डेथ हो गई या उसके बेटे की डेथ हो गई, एंड नाउ द लेडी इज नॉट एबल टू क्राई एट ऑल. तो बोलते हैं ना कि उसको रुलाओ, अगर वो नहीं रोएगी तो उसको प्रॉब्लम हो जाएगी. सो द नॉर्मल रिएक्शन शुड बी दैट वंस यू हियर द डेथ ऑफ अ लव्ड वन, you should cry it out. You should cry that grief out. But the emotional shock is so deep that the person is not able to cry at all. So in such cases, you have to give ignatia or natramute depending upon the prominent symptoms. However, ignatia is the acute of natramure, and natramure works much better in the chronic state. So similarly, you can check out other rubrics also, like depression, strong emotions, ailments from, then enemy thinks everyone is, fear is also a very very huge rubric with a lot of sub rubrics like ailments from, fear from alone, fear from the crowd, fear of being alone, fear of darkness, fear of death of a loved one, fear of losing wealth, etc., etc. So whole lot of pages are involved in this. Then there is mind frightened easily. There are some people who get startled very easily, they get very very frightened. Then there is grief, then there is guilt, then there is helplessness. So according to the prominent symptoms of the patient, you can find out the rubrics, and then you can find out the remedy ultimately. Now, continuing with the rubrics, there is homesickness, horrible things, sad stories, movies, ailments from. This is very important. There are some children who cannot look at horrible things. Even in the movies or on the television, they won't be able to see the cruelty onto the television. Someone is killing someone, even in the movies, they will cry or they won't be able to see it. So generally these people fall into the Kilcaria group or the Kilcaria carb itself, and this is a very very important rubric. Then there is mind humiliation, then there is mind injustice, ailments from. There are certain remedies like the magnesia group or the causticum where they have ailments from injustice. They will be highly affected with injustice either done to them or to the other people also. Then again, an important rubric is the panic attacks, fright after. They will get into the panic attack, and the important remedy is aconite and opium, which are given in the bold or in the capital. And the second grade remedies are arsenic, gelsemium, and silesia. And the third grade remedies are lyco, murk, natramure, etc. Now, aconite is the most important remedy during these times of the war. You will see a lot of patients who will need aconite during these times, because aconite is also one of Dr. Clark's ABC nursery remedies, like A for aconite, B for belladonna, C for chamomilla, and they stand for turmoil in circulation, turmoil in brain, and turmoil in temperament respectively. So aconite is for turmoil in circulation, and everything in aconite is just like a storm. Everything is coming suddenly and violently. All the symptoms are coming and they are full of energy. Aconite and belladonna are two most energetic remedies of the entire materia medica. The more they get sick, the more energy they have. And aconite will have a lot of energy. They are robust personalities now, very very robust and strong built. They have usually the sulfur constitutions, and they have great fear, fright, and anxiety of mind with intense nervousness. And it is also one of the trials of the restlessness, others being arsenic and rustrox. But arsenic में क्या है? Arsenic people are a little weak. उनको इतनी एनर्जी नहीं है जितनी एकोनाइट को. एकोनाइट इज़ वेरी वेरी एनर्जेटिक. वो इधर बैठेगा उधर बैठेगा, कॉन्स्टेंटली टॉसिंग अबाउट. दे विल नॉट सिट इन वन प्लेस. They cannot stay in one place. They are full of energy. Arsenic also wants to move, but they don't have that much of energy. उतना उनको energy नहीं है. They are a little weaker compared to that. So aconite is very very energetic, and mentally उसको बहुत ज़्यादा restlessness है because of the so much fear. And इतना fear है just like कि उसको time bomb बंधा हुआ है. It's written in aconite that they are very clairvoyant. They can even predict the time or even hour of their death. So they have that kind of restlessness and fear and fright. And also the music is unbearable to them. If you try to calm them and relax and चलो कुछ बजा देते हैं थोड़ा सा म्यूजिक, थोड़ा सा माइंड रिलैक्स हो तो, बट दे कैन नॉट हैव लिसन टू द म्यूजिक एंड stay quiet. It is unbearable to them. Then gelsemium and opium are remedies for weakness. Generally, gelsemium patient will be very dull and drowsy and sleepy, and they don't have energy. They cannot move about. Opium also, they will be very dull and drowsy only kind of people. They will not have that much of energy. But वो आतंक आप देख पाओगे ओपियम के चेहरे पर, एकोनाइट के चेहरे पर. यू विल फील दैट फियर. वो एक आतंक नजर आएगा उनके चेहरे पर. Then, as I said, of restlessness, there are trios of restlessness which has aconite, arsenic and rust ox in it. So arsenic may be restlessness है. Then mind sensitive you can take. Mind shock, emotional ailments from. Mind startled, people get startled very easily. Phosphorus will get startled very easily. Kali also, some groups, उनको आप touch करो तो बहुत डर जाएंगे suddenly कि क्या हुआ. Then mind stories frightful or movies aggravation. Now this is a very similar rubric which we had studied before. Mind horrible things, sad stories, movies, ailments from. So this is also the same thing. Mind stories frightful or movies aggravation. They cannot see frightful or movies full of violence, etc. Then there is another rubric, mind stress overwhelmed by, and mind suicidal disposition. So these are some rubrics which you can select according to the dominant symptoms. Then continuing with the rubrics, mind sulky, mind talking, war off. There is a rubric in Murphy's repertory. I don't know whether it is in the Kent's or not, but here in Murphy's it is given mind talking, war off. So there are 4 remedies given. I only know 3 of them: agaricus, belladonna and hyoscyamus. So again, these are the rubrics. Mind violence ailments from. Usually calcarea will be present in this rubric. They have highly sensitive, they are highly to the violence. They have ailments from even thinking about violence. Then sleep, insomnia, excitement from. Now this excitement is usually positive, usually from the good news. So coffea is indicated in case of insomnia from excitement or from hearing any good news. So if you're winning in a war, people might get excited, and because of the excitement they will feel insomniac. Then I have described some core rubrics for anxiety from the Murphy's repertory. So I'm not going to read them out, you can just go through them. Then again I have listed some of the remedies for anxiety, different kinds of anxiety, anxiety with fear, and general anxiety, anxiety before events, anxiety at night. So at night we have arsenic, calcarea carb and sulfur. Anxiety with restlessness we have aconite, arsenic and rust ox. Again I had described the trio of restlessness. Then anxiety about health is arsenic. Anxiety with fear is aconite. They have sudden panic. Phosphorus is sensitive. Phosphorus patients are very sensitive, empathetic they are. Sometimes a person is having a stomach ache and you tell the phosphorus patient will also experience the same pain. So they are so much empathetic that they will feel your pain. They will have the same symptom. So this is very strange with them. Then pulsatilla, we all know that it is very clingy. They want company and very weepy. So anxiety with desire for company, we have arsenic and pulsatilla. Arsenic because they have fear of death, they don't want to be left alone. And pulsatilla because every time they want company, they also don't want to be alone. Then anxiety with aversion to company, we have nitramur and sepia. These 2 remedies have consolation aggravation. They don't want to be consoled. They just want to be left alone on themselves. Then there are 2 remedies which are hypochondriac. There is nitric acid and lycopodium. Nitric acid is especially hypochondriac because they have fear of cancer. नाइट्रिक एसिड को कंफर्म है कि उसको कैंसर है, उसको कुछ भी इतना सा भी थोड़ा सा भी एकदम बेनाइन सी ग्रोथ होगी तो उसको कंफर्म होगा कि ये कैंसर है. और वो बार बार they will go to the specialist and they will get checked it and they will get all the tests done and they will say no, it is benign, it's not cancer. तो वो बोलेंगे नहीं, इस डॉक्टर को कुछ नहीं आता, हम दूसरे डॉक्टर के पास जाएंगे. And they will again repeat the process and they know that they have cancer. They will not believe in the tests or in doctors. So it is kind of hypochondriasis, or even so kind of delusion in the severe stages. So, and also lycopodium has it. Now I have listed some frequently used homeopathic remedies for these frequently encountered symptoms like shock, trauma and fear. You can use aconite and arnica. For grief, sadness and loss, you can use ignatia and natramur. For post-traumatic stress disorder and nightmares, you can use stramonium, opium and arsenic. Then for anxiety and restlessness, again aconite, argentum nitricum and gelsemium. Argentum nitricum is also a very very good remedy for anxiety issues, especially if they are along with the gastrointestinal disorders. Then insomnia, coffea cruda, passiflora and hyoscyamus. Then anger and rage, you can go for nux vomica or Staphysagra. Staphysagra are very very dignified people. They have high esteem of themselves. So they feel insults very quickly. And they have ailments from all that feelings. Then again I have listed frequently used batch flower remedies for these conditions. So you can also go through them. I have used rescue remedy. I usually use it. It is a combination of 5 remedies. So you can use rescue or you can use them individually also if the prominent symptoms are visible in a patient. But I usually use them as supportive. I don't use them alone. So for over concern for the welfare of the loved ones, we have red chestnut. For terror and fright, we have rock rose, and for shock, we have star of Bethlehem. Now, these are some important remedies which you are not supposed to miss out. So for all the students or for the young practitioners, I'd like to say that it is aconite, argentum nitricum, arsenic, calcarea carb, gelsemium, ignatia, kali ars, opium, phosphorus and stramonium. These are some 10 remedies that you're not supposed to miss out, and you just go through them. I was planning to describe them, each one of them in detail, but unfortunately in the morning only it was decided that it's my presentation today, and the topic was decided very quickly, so I could not make the PPT that way. So anyways, you can go through the materia medicas. So many materia medicas we have. You can go through any of them regarding all these 10 remedies. And while studying, please pay special attention to the mental symptoms of these remedies, which is the crux of these remedies. So that was my PPT, and I have consulted so many books. You can check out the bibliography later on. So thank you so much for giving me the opportunity. And before we end, I'd like to conclude with some verses of Bhagavad Gita, chapter 2, verse 31. Arjun, as a Kshatriya, is reminded by Bhagwan Krishna that righteousness, war is his sacred duty. ये धर्म युद्ध है और ये तुम्हारा कर्तव्य है. Then chapter 2 verse 33, avoiding battle out of fear or confusion would lead to spiritual and moral downfall. Then the third, chapter 11 verse 33, my favorite, so I'm going to read this out. तस्मात्वमुत्तिष्ठ यशो लभस्व जित्वा शत्रुन् भुक्ष्व राज्यं समृद्धम् मये वेते निहता पूर्वमेव निमित्त मात्रम भव सव्यसाचिन. So when Arjun said कि I don't want to kill them, they are my brothers only, I don't want anything, I'm not going to kill them, then Bhagwan Krishna said that I've already killed them, you are just an instrument to my work, so do it, and as a Kshatriya it is your duty to do it, because they are on the path of adharma and therefore I have already killed them. Then the fourth one, chapter 18, verse 17, where Krishna emphasizes then when action is performed selflessly and in accordance with dharma, the doer incurs no karma. So the doer is not bounded by any karma. So, friends, with this, I conclude my presentation. And here's the takeaway that we all need to stay calm and stay united in these challenging times, and we should trust our real heroes serving at the borders of our nation. And it's very, very essential to stay calm and composed. And if you're suffering with panic attacks, first of all, limit all the news intake and reassure all your loved ones and encourage them also to remain calm. So, and also refrain from buying unnecessary items and prioritize your essential needs. So, ultimately, pray for peace and may peace prevail. And last but not the least, if you are suffering from any emotional or mental breakdowns, do use homeopathy. Seek help, professional help from a professional practicing homeopath near you, because homeopathy is a boon to humanity and it will definitely help you out during this time of crisis. So, thank you so much yet again, and I'd like to conclude with a salutation to our Indian Army कि उगते सूरज में डूबता आतंकवाद देखा, ऑपरेशन सिंदूर से डरता पाकिस्तान देखा, देश की रक्षा करता सेना का जवान देखा, आज फिर से मैंने मेरा भारत महान देखा. सो जय हिंद एंड जय हिंद की सेना. वंदे मातरम. Thank you so much, friends.
Thank you so much, Dr. Rachna. It was a wonderful presentation, and I'm sure it's going to be very useful for people who have attended this session. The all the drugs which were discussed, yes, they have great use during this period, especially the war, the crisis period that we are into. Yes, and certainly this you whenever we upload this video on YouTube, it can be kept as a reference for everyone, and rather even shared amongst other people, so that awareness regarding homeopathic drugs and their utility is created. So certainly homeopathy has a big role to play, and we all can do a lot for our country in our own small way. So before we end the session, I would like to ask whether there is anyone who is wanting to ask any questions or would like to discuss any personal experience as far as handling such situations is concerned, or patients who have been in war situations. And if anybody would like to even speak about this, they are welcome. We have time. That for injustice, even causticum is used. This is one input from her. And arsenic anxiety is more, and in aconite, the fear is more. Okay, so these are few trips from Dr. R. Shripriya. Anybody else who would like to share their experience or any further inputs, any further remedies which have been useful to them in practice? Uh, Dr. S. Rani is asking, what are the medicines for sleep? Yes, a very nice question. Due to anxiety, due to panic, sometimes patients do feel sleepless, or they do have insomnia. So, how can we tackle that?
So, Kofia was the main remedy that I had shown in case of insomnia due to excitement. But there can be other reasons also for insomnia. So, you have to dig into the all the other reasons subjectively, whether the patient is really excited or not. Because the Kofia medicines ultimately work because of the cause. If the cause hits right, the medicine will work. So I think that's the reason we have to find out the cause, exact cause of insomnia, because insomnia is a symptom and we are not treating symptoms here.
Okay, somebody has asked, what is it after loss of loved ones? Which remedy?
Loss of loved ones, I think Ignatia is the most frequently used because of that emotional shock that they go through from loss of a loved one.
Okay. Dr. Kishori Pagar has spoken about opium. She has written opium is in content fear of extravagance. And two other remedies for sleeplessness after loss of loved ones. She has suggested natramur and homeorace in addition to ignatia. The
Yes,
question is for
natramur is the chronic of Ignatia. We can use natramur also in the acute state also, but generally we give Ignatia first and then we can use natramur if the symptoms match.
Okay. Another question which has been raised is, can you suggest any remedy for the Jawans? Because they are at the war site, and what could you suggest? What remedies would be most useful at the border if we have to send them quick aid? First aid, we can say.
First aid regarding the physical thing.
It could be anything. It could be remedies for anxiety. It could be remedies for, I should say, even injury remedies would be
Injury
useful.
remedies is something different that we can send arnica, etc. All we have the whole list of injury remedies. But in case of if we are talking about the mind, the
Hmm.
emotional
Hmm.
and the mental issues, then there is
Hmm.
a rubric in the
Hmm.
repertory: mind, stress, overwhelmed by.
Hmm. Hmm.
That is a rubric which we can take. So whatever remedies are coming into that rubric we can check, and we have to take, finally we have to take the whole case. Now we have to treat subjectively. We cannot, it's not like that we can treat with everyone with a single remedy. But yes, the most
Correct.
frequently ones I have highlighted already.
Correct. 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 Any further questions? Dr.
Padmaja ma'am.
Kishori Pagar has written for mental, says causticum is at the top.
Yes,
And
causticum is a very good remedy for injustice, ailments from injustice.
correct.
So we can use it.
Dr. Annapurna has put in some inputs. She has written that in general, has supportive medicine, Kali for 6x and Passiflora mother tincture work beautifully in addition to the indicated remedy. Based on the cause, as Dr. Rachna said, I got satisfactory results with this in sleep issue. So, one more input. We have two remedies, Kali for 6x and Passiflora mother tincture. Yes, we can remember those.
Passiflora mother tincture, yeah, people have used for insomnia, but usually it is said that it is more indicated in the obese people. But I don't know.
Okay.
I have not used the mother tincture, but Califos, I agree. I do agree that I have used it in the form of biochemic. It has helped a lot in calming down the person.
Okay. So it was a wonderful session. I think.
Yes, Dr. Alka, didn't you see my hand raised there?
Yes, ma'am. We are waiting for you.
So you are about to conclude. You are not waiting. You have not seen that one. So
No,
that's
I
why I have on
didn't
by
see
my
your
side.
hand. I
No
just
problem.
was reading
No
the
problem. No
messages.
problem.
I didn't
Yeah,
see your
no
hand.
problem.
Sorry
So
for that,
Rachna, it
ma'am.
was a no problem. So Rachna, it was a very good session, though I have joined very late because of my clinic time today.
Okay.
So actually, you have done the basic work done. As Dr. Alka is mentioning that we could use this as a reference also. And the thing I just want to add is you are asking about some cases. Yesterday only, or 2 to 3 days before, I had a case like this. Very educated lady, very not that much of fat or obese, but she's having that type of anxiety that she's not able to control that anxiety. So anxiety and fear without any such a cause is also not there. But what she says is my this one are not listening to me. My family members, they are all so good in helping, but they are not listening to my anxiety. They say that is only anxiety. Take rest. But I know this anxiety is. I want to just go out of this one and I just want to land in a hospital or I will die, something like that. So, for example, I have given Aconite and I have made her sit in my clinic for some time, and she is quite well and she is very happy. And what she says is her chest pain is there like acidity. So, I have given bio combination 25 also to take as and when possible, as and when necessary. She is better, okay. 3 दिन हो गया और 1 हफ्ता हो गया आज आज फिर आई हूँ. So फिर आई and what she is telling that 2 days back when you are given the medicine it's good with me, but after going home again I had extreme chest pain and I went to the hospital and they have done ECG, 2D echo, everything has been completely done. So seeing that all the everything is normal with her, and she is very good in meditation. She is very good in her daughter is in psychology student, so she is doing everything, meditation, whatever we say, Bhagavad Gita, everything she is doing. But she somehow, maybe it is the menopausal anxiety or something. So she is not able to come down out of it. And regarding the war, एक दो दिन जब से war का ऐलान हो गया, तब से उसका problem और भी बढ़ गया. Then she came to the clinic. Then I made to sit her, and what she is telling now, I can't see, I can't watch anything horrible on the TV also, madam. I don't want to watch the serials. I don't watch serials. में ऐसे वैसे दिखाते हैं. I don't want to watch. I want to watch only old classical movies where only happiness is shown. So that is the point where I have given her calcarea carb in millismal doses, and asked her to sit in my clinic for a while. Again, for 1 घंटा मैंने उसको बिठाई, so that I am seeing 1 घंटा 10 minutes, 1 dose of calcarea carb 0/1 repeated, and she is quite fine. फिर उसको डाउट लग रहा था कि फिर घर में जाने के बाद फिर आएगा क्या, like that. Then I said that no, you take this millismall water and take 1 dose every day for 10 days, and you take that aconite as reserve. So this was the first case of my war anxiety in this reel, and it will go on like that. So whenever you are telling about aconite and this one, I got to remember this case just now, which I have finished and come back and matter like that. And the one more input is coffee is used only for excitement, insomnia, excitement only. Excitement in the sense it should be very happy. Coffee, the patient will be very happy. No other excitement, only happy. And happy, with that happiness he can't able to sleep. मुझे एक पेशेंट था पहले, वो एक क्रिकेटर है, वो ही इज स्टेइंग इन लंदन. सो देयर व्हाट हैपेंड इज ही रोट ए बुक ऑन क्रिकेट. उसका इंडिया में बहुत ज्यादा हो गया था, और एक आई थिंक ही हैड बीन अवॉर्डेड समथिंग. सो ही वाज बैक टू इंडिया. ही इज एन इंडियन ओनली. ही वाज बैक टू इंडिया and he was circulating near my clinic. He doesn't want to come inside because of the excitement also. And after that, when I came outside, doctor, I need some medicine. But he is happily laughing. I know his name, I think it's Bharat. So what is that you need, Bharat, here? You are looking very happy. My book has been awarded. Oh, congratulations, very good. Something party, yes, bol rahe the. But he is not able to sleep. That day he went coolly. Again, the next day he came. And I thought that what is that you are coming for? So I can't sleep, madam. This excitement is doing. Then that time I have given him coffee cruda. एक्साइटमेंट स्लीप के लिए कुछ और वो होम्योपैथी में ट्राई करके फिर आए थे. इंसोम्निया के लिए ना जाने क्या क्या कॉम्बिनेशन रहते हैं, कुछ और लेते हैं. लंदन में भी वो होम्योपैथी लिया था. इट्स नॉट वर्किंग. देन द थिंग इज एक्साइटमेंट विथ स्लीपलेसनेस विथ हैप्पीनेस. So then the only symptom, Coffee Cruda has taken care, and he went to Delhi to take the gift from our Rashtrapati on 26th January, according to his this one. And he is very good. After जाने के लिए आने के लिए he has taken about 2 weeks time. He is completely better in that 2 weeks time. That was one case of Coffee Cruda. And the other thing inputs are Califos and Passiflora, right? So Passiflora is nothing to do with the anxiety, only insomnia, sheer insomnia. So even in mother tinctures, mother tinctures obese are normal, किसी को भी चलता है mother tinctures. And the other thing is insomnia with lung conditions also is the best for Passiflora. Or otherwise, normal insomnia, we can give first grade remedy Passiflora and lachesis. Without any indications, we can prescribe lachesis for insomnia also in smaller potencies, or as the case may be. And the other thing, Califos 6X generally has a calming nature on our mind. But these days, we can rely on combinations also. Like the other day, I was explaining about Tranquil. Tranquil एक टैबलेट्स है SBL कंपनी का. उसमें कैलिफॉस ऐसा नहीं है, नॉर्मल नॉर्मल इंडिकेटेड रेमेडी, नॉर्मल हमारा पॉलीक्रिस्ट रेमेडी सी 6x में रहते हैं, और थोड़ा सा स्मॉल रेमेडीज भी है लाइक वाइबर्नम, कुछ और है उसमें, मैं याद तो नहीं है मुझे, बिकॉज आई विल बी प्रिस्क्राइबिंग डे इन एंड डे आउट, डे इन एंड डे आउट. I don't know. I may have prescribed some 100 lbs so far. The tranquil tablets. That much frequently I give the tranquil tablets. And yes, Dr. Pungirali, passiflora is indicated in hypertension cases also. Insomnia related to hypertension is related with passiflora. No? And and as such, if he decrease the BP, the sleep will always return back. That is also one issue. And tranquil tablet, anybody can use. This is a common tip you can take. That is from SBL company, tranquil tablets. Anxiety, restlessness, sleeplessness. This is the main thing. I use like anything that for every patient, whoever is having insomnia and anxiety, I'll make them use the tablet. And after that tablet, they won't complain the symptom also. There will be no need to give for the main medicine also, because all these symptoms, no, insomnia, maybe her complaint may be some more depth in more depth her complaint may be, and this insomnia may be the associated symptom, and we may be focusing on that insomnia also. Maybe the vital force is not speaking about insomnia, maybe it may be speaking about more than insomnia. So if giving like this combination remedies in smaller potencies or 6x potencies, they will clear the other symptoms in the very most very multi-miasmatic cases, and the very most depth symptom will be focused, and then we can treat that one. Yes, Dr. Annapurna, melatonin 4x is also very much helping in only the melatonin deprived cases, like those who are not getting up in the morning, and those who are working in the night, late nights, the software persons in the night shift people. So for those people, and those who are really having black patches on the face, like that we are saying the butterfly patches will be there. Generally we will be using sepia for that one. So like that we will be thinking that it is anemic spots, but sometimes the melatonin hormone is also working on the pigmentation. In that cases insomnia is there, melatonin 4x works very well, and that is actually the sarcode these days, because the abroad people are using melatonin like anything. Sleeplessness, they take melatonin hormone regularly. So we have been potentized that melatonin into melatonin 4x, and it is also helping us like that. Okay. So these are all my little inputs in this month, and really it is a very good session, Dr. Rachna. Congrats to
Thank you,
you.
ma'am. Thank you.
Yes, we have
Uh,
inputs from
I
Dr.
take
Rachna
2 minutes.
Srivastava also.
Yeah, 2 minutes I will talk. Yeah, I want to give specific inputs about adrenaline. I used in a patient who is hypertensive, heart patient, thyroid, all the things you can think, and he had even um, he's a chronic smoker as well. So he had fluctuating high BP and low BP in that way. So he was very anxious, like death is about to come and that way. So he was helped with adrenaline 3x for almost 3 to 6 months. It became like default for him. So it helped to regulate his high blood pressure, and also his thyroid was regularized. So we can even add adrenaline. I don't know whether Dr. Rachna mentioned it. If not, please add. Yeah, thank you.
Sorry, ma'am, I didn't hear you.
Adrenaline, you added
No,
for
I
the
have not
anxiety.
added adrenaline. I'll add
Yeah,
it.
you can think of that also.
Yeah.
Yeah,
Yes.
high blood pressure and low blood pressure, it will be fluctuations.
Yeah. Yes, ma'am.
So physiological doses, it will reduce increases the blood pressure. In 6x and more, it may reduce the anxiety and blood pressure. That's it.
Okay, ma'am.
Okay, thanks.
Thank you so much, Dr. Rekha, Dr. Padmaja, for your wonderful inputs. Yes, thank you, Dr. Rachna, for the presentation. It was really very useful. And thank you, audience, for having attended the whole session. Yes, we'll be having many more interesting sessions in the future too. So, good night, everybody. Meet you all again tomorrow night at 9 p.m.
Good night.
Bye bye.
Thank you so much for the opportunity. Thank you.